Dr. Tom Frieden is the former director of the CDC and former commissioner of the New York City Department of Health. He is currently the president and CEO of the initiative Resolve to Save Lives, which works to prevent epidemics. Dr. Frieden, good morning. Thanks so much for being with us.
Good morning.
I want to start by putting this in some perspective. You follow the city statistics very closely here in New York. Roughly how many people are we losing every day to the coronavirus right now?
Tragically, there are hundreds of deaths each day, as many as 400 or 500. The numbers still are being verified because it's so overwhelming for our hospitals and health department. This is a tragic time, but we are beginning to see cases decrease, and that's why it's so urgent we prepare for the next phase.
Before the pandemic, typically how many people would the city lose in a single day?
There were in New York City approximately 150 deaths a day. So there are 2 or 3 times that just from COVID in these terrible days that we're living through.
As Tony and Gail just reported, there is a more encouraging model that we're seeing that suggests that the death rate may not be as dire as we feared. What do you make of that model?
I think models can be very helpful if they help do things like allocate the number of ventilators or prepare health facilities for a surge or guide us in when we may be able to more rapidly turn on or turn off the physical distancing interventions. But this idea that they're going to guess the number of people who die seems a little gruesome to me. Fundamentally, we need to do everything we can to reduce the number of deaths to as low a number as possible, because every one of those numbers is a life, it's a face, it's a family, it's somebody's relative. And those numbers really bring tears to my eyes. Every night I look as New York City reports its deaths. It's well over 4,000 already, and many more still being counted. This is a terrible, terrible pandemic, and it moves incredibly quickly. And that's why we have to use every single moment during this time that we're sheltering in place to get ready for the next phase, where we need to box the virus in. We need to box COVID. We need to do that with 4 key measures: testing widely, isolating effectively, finding contacts, and quarantining the contacts. If we do those 4 things, we can box the virus in and be able to steadily, gradually go back to a new normal.
You say we need to loosen the faucet gradually, not open the floodgates all at once. In your view, what exactly does that mean for ordinary people in terms of going back to ordinary life?
Well, first off, the government and society need to be ready to test massively. We're not testing on anything like the scale that's needed, and it's taking many, many weeks for the White House and Washington to scale this up. I'm afraid we're even possibly months away from having enough testing capacity in this country, and that's really dangerous. Second, we need to be able to isolate people safely, whether in hospitals or nursing homes, homeless shelters. We need to identify all the places where it's spreading and reduce that spread. Find contacts of every person who's ill and make sure those contacts are safe and don't infect others if they themselves become ill. But for most people, this means right now, shelter in place, do not go out unless it's absolutely essential. And if you do, please wear a face covering, because that will protect others as well as possibly yourself. But what we expect is that when things begin getting better, we might say to people who are older or who have serious underlying conditions such as diabetes or lung disease, you're going to have to stay in for longer. We're going to gradually bring people out, and things are going to look different. We're not going to shake hands. We're going to use hand sanitizer at the entrance of all buildings. Some places may decide to take temperatures with a no-touch thermometer on everyone who enters. All these things are going to be different. We're not going to shake hands for a long time, but we will be able to come out and to a new normal. But to get there, we have to make our healthcare system much safer.
All right, Dr. Tom Frieden, thank you so much for being with us this morning.